Joining me right now for more on this and the state of the pandemic is Dr. Megan Ranney. She's an emergency physician at Brown University. Dr. Ranney, I just still cannot understand why a face covering, and none of us we should all refuse to accept this, that a face covering that takes absolutely zero effort, it does nothing but protect you and others, how people have gone so past the point of no return over this. A woman's dead today because she was enforcing a private business's policy. Your reaction?
It is terrifying and infuriating. And, coming off of the Attorney General Garland's press conference, it's the same trends, right? It's misinformation. It is easy access to firearms, and it is resorting to anger before anything else. Let's be clear, masks work. The science supports them. We need to get rid of the misinformation saying that they don't. Firearms. It is so easy to get a gun these days. You can purchase a gun more easily than you can purchase Sudafed in some states. And some people are not safe to own guns. And then anger. What happened to a country where we can shake hands instead of shouting at or shooting each other first? All three are fixable, but it is the confluence of all the worst of our country in one horrible event.
It really is all connected, and I think it's important that you made that connection, Dr. Ranney. So that is happening in Georgia, but there at the same time is another major moment happening as well. It's kind of this juxtaposition of the pandemic right now. The most populous state in the country is reached this big moment of lifting all COVID restrictions as of today for the first time in, I think it's over 15 months. California is essentially fully reopening. What does this signify?
California was one of the first to close and is now one of the last to reopen. They have done a good job of following the science. Their vaccine rates are excellent. Their infection rates are low. But we can't be seduced into thinking that this pandemic is over. The virus is still spreading out of control on a global level. And of course, there are many states across the US where vaccines are not being given at the rate that they are in California. And we know those folks are going to be coming into California, going to Disneyland, going to LA and San Francisco. And I fear that we're going to see more conflicts like the one in Georgia, as individual business owners are put in the spot of having to dictate what public health precautions are instead of our states and our federal government standing up for the rest of us.
And Dr. Ranney, also at some point today, the country is expected to reach and pass the 600,000 mark of Americans who have died from coronavirus. And everyone has become a bit numb to the numbers. But look at these comparisons that the team put together. Comparing COVID death, the death toll, it's surpassing all major recent U.S. war casualties. How do you reflect on this now? Because there is so much hope in getting past this pandemic. It almost feels extra cruel that folks are still dying of this when there is this protection out there now with the vaccines.
Yeah, as an ER doc, the only people I am seeing now who have COVID, the only people I am hospitalizing, the only families I am calling to tell them that their loved one is on death's door are people who have not chosen to get vaccinated. Every American adult can get a vaccine now. And I think it is so important for us to remember that each of these 600,000 people is a person who was a mother, a father, a sister, a brother of someone, and they left behind a family. Not only that, of course, are the millions of people who've had COVID and are still suffering from its after effects. I hope that we take this moment, really take a moment to grieve what we've been through as a country, and then double down on making sure that we do get those vaccines in arms.
Yeah. Dr. Ranney, thank you very much for today.
Thank you.